Good morning, everyone. Welcome to Pediatric Grand Round. If you're driving into work, thinking about driving into work, already at work, please join us in the Mill Mountain Conference Room. We've got breakfast today, and it's a sort of a joint celebration of Banco Resident Week, which was this week. I think we missed it by a couple of days. And there was also a celebration called Solidarity Week about 2 weeks ago, which was thanking all providers for their humanistic approach to healthcare. So just keeping the patient in front of us. Please join us for breakfast. Today's speaker is Dr. Mark Patterson. He's a general pediatrician who joined Carilion in 2005. He tried to retire in 2021. That lasted about a year, and then he's been unretired since 2022 and pretty much working full-time. He went to medical school at Albany Medical Center in New York and did his pediatric training at UVA. He also has a PhD in biochemistry from MIT. He has a special interest in narcolepsy and cataplexy and is the founder of the Narcolepsy Awareness Nonprofit Day 4 Naps. Today, Dr. Patterson is speaking on the topic of infantile colic. Is it really the gut? Please join me in welcoming Dr. Patterson.
Thanks for the introduction. I just want to point out that my nonprofit Day for Naps had its 5th birthday yesterday. So it's kind of a narcolepsy awareness nonprofit. And when I started pediatric training about 35 years ago, colic was this big mysterious thing that was very frustrating as a clinician, because the kids were obviously very uncomfortable, the parents were super frustrated. As a clinician, you felt very inadequate being able to do much for the family. And so over the years, the reason I chose this topic, so over the years you want to know what advances have made in this 35 years. So that's why you got interested in this in the first place. I have no disclosures to report. And colic is one of these vague things that different criteria over the years have come up, and there's a group that meets every couple of years in Rome. The most recent one was the Rome 4 criteria. It met in 2016, and they discussed different GI issues in pediatrics and set the criteria. And the most recent one in 2016 set the criteria for, as you see here, recurrent prolonged episodes of crying. Episodes can be prevented or resolved, so families get frustrated because they can't really solve it. And obviously the biggest thing is make sure there's no underlying medical condition. So it's important to make sure you check the newborn state screen and that sort of thing, make sure there's not some metabolic condition that's responsible for it. Typically the infants are between birth and 5 months of age, but it can be, these criteria, the ones that are typically, and it actually is very prevalent throughout the world. It's estimated anywhere from 10 to 40% of kids worldwide have symptoms related to colic at some point in their newborn period. And when you look at the literature on it, and there's reports from, like I said, all over the world. It's not just a Western or a European condition. There's lots of publications from India, from Turkey, from Iran. Those are a lot of the countries that put out a lot of publications about it. So it's kind of a global problem everywhere. And typically it peaks around 6 weeks of age. Usually has onset by about 2 weeks, but it peaks around 6 weeks. And like I said, it lasts to about 3 to 6 months of age, then it kind of resolves. And because it's kind of a self-limited thing, the question is, why do you pay a lot of attention to colic? You kind of tell the parents you want to bear with it for a while, then it kind of get better eventually. Well, we've all seen kids who cry. Being pediatricians, that's what we deal with every day. As your parent, you deal with it personally as well. But with kids with colic, it's kind of a little step up from what you normally experience with it. So here's an example of about 30-second clip of a baby with colic and what the parents are trying to deal with. So as you can see, the parents trying to calm the child, but it's not having much of an effect on it. And you can imagine, like I said, if this happened just once in a while, you can sort of deal with it. If this happens, every single day, for weeks on end, you can see why it'd be very frustrating for the parents to try and deal with. And you can hear by the cry, if you hear the baby cries, you can tell it's different than the usual cry that babies experience. You can sort of figure out what's wrong with it. So that's kind of the issue with the colic that does cause such stress in the kids and the families. So historically, in addition to being a global phenomenon, colic's been around for a long, long time. One of the first descriptions of it was the Egyptian Ebers papyrus, 1600 BCE. And this kind of papyrus is one of the first medical texts, as it were. A lot of the things deal probably with diabetes, but there is a thing in there about, to help continuously crying infants, get poppy extract. Obviously, opium comes from poppies. So that's one thing that did calm the babies down. That was something they tried to deal with back, almost 4,000 years ago. In the late Babylonian period, 6th century BCE, there's a tablet that spelled out a ritual to quiet babies. If you have babies in general but they're crying, or particularly colicky babies, parents would have this ritual to try and go through to try and stop the crying and try and avoid the crying in the first place. So even 3,000 years ago, they're trying to figure out what ritual to invoke to try and get babies to stop crying. And the famous Greek physician Galen, who practiced in the 2nd century, prescribed opium again to help babies. So there's kind of a common theme here. They give opiates or opium to try and calm babies down. It worked, but it's not really the preferred way of doing things. And here's the tablet that had the ritual to try and quiet babies. I'm not up in cuneiform, so I'm not sure exactly where it says that. And what caught my eye when I was typing this out is that the first part of it is baby, so that would clearly have something about pediatrics in there because it has baby in the name. And why is colic a problem? Because like I said, it's such a common thing to present with in the newborn period or in the early infancy period. So it's actually a pretty common issue to deal with. And even though it's sort of a benign condition, it does put a burden on the healthcare system, on families in trying to deal with situations. The biggest risk factor is kind of the third point here, is that excessive crying has been strongly associated with maternal depression, which we all screen for anyway when they come for the newborn checks. And the biggest thing is the strongest risk factor for shaken baby syndrome. So it's not that colic necessarily, excessive crying necessarily harms the baby, but the parents are frustrated, and it's a really high risk for having the babies be injured. Because like I said, that little clip you heard, you can imagine if you deal with that every single night, after a while, everybody gets so frustrated, and it's easy to lash out against the baby to try and make them stop. And that's why, shaken baby syndrome is the worst side effect of colic. Other thing it does too is that, the moms feel very unfulfilled because they think it's their breastfeeding or something they're doing that plays a role in it. And that's why it's a real high risk factor for early cessation of breastfeeding. And the parents, if you're a parent, you kind of know that anything your baby does or doesn't do, you blame yourself for. So it is really easy for parents to blame themselves or their parenting skills or the lack thereof on the reason the baby is having the colic symptoms. So there's a lot of problems with it other than just the physical discomfort to the child. And the biggest article that came out, in addition to the ancient literature, it came out 70 years ago in 1954. There's an article by Dr. Wessel and his colleagues up at Yale University in Connecticut. And it kind of was a classic one that looked at colic. And as it is said, it was the paroxysmal fussing of infancy, sometimes called colic. And they described that the common terminology that usually was described was, the paroxysmal fussing, irritable crying, compulsive crying, infantile colic. It was kind of poorly defined otherwise at that time. Part of what they did in the article, they performed a thorough review of the literature up to that point, 1954, and they came up with the possible etiologies that were postulated at that time. And the four main theories at that time for it was this thing called the concept of congenital hypertonicity. I'll get into these things a little bit here in a second. Allergies, which still thought maybe an issue with it. Sort of relative immaturity of the GI tract in these newborns, and parental influence. And like I said, with all these different things were kind of the theories of what colic is caused by. And the idea of congenital hypertonicity, some kids are just kind of, we all deal with babies all the time, particularly newborns. Some babies are kind of just chill and kind of mellow. Some are kind of just very agitated all the time and very sort of high strung. And the thought was that there's these hypertonic infants, sort of imbalance of the autonomic nervous system, particularly the parasympathetic nervous system. And there's a term called vagatonia, which was popular back in the first part of the last century. We're getting an imbalance of the vagus and the parasympathetic nervous system. And the thought was that these kids just have an abnormal response to this external stimuli, that things that would not bother some babies really seem to set these babies off. So they seem to be just more aware of things. And at the time, the recommended treatments were atropine and phenobarbital, which we kind of shy away from at this point in time. And they work, but it's not really what you want to do to little babies. The idea of allergies was first proposed about 120 years ago, and that was that certain proteins in the milk seemed to, they thought when gaseous decomposition resulted in the distension of the GI tract that causes symptoms in the kids. And the thing they've noticed, which we still notice today in a lot of our recommendations to families, that certain foods in the mother's diet may play a role in it, although it never was clear exactly which ones played a role. And they found out too at the time that if moms have a hypersensitivity to proteins or certain proteins, then sometimes the kids are more likely to have colic symptoms. The physiological immaturity of the intestines, they thought that the GI tract has gotten easily overly taxed, and they thought that the material would accumulate in the lower ileum, and because of that, they had to have increased peristaltic contractions to push the stool through, and that was, the abdominal pain that was perceived by the child to cause colic. The last ones were parental influence. And the thing they pointed out in the review of the literature was that usually it's firstborn babies that have colic. A lot of times breastfed babies have a colic. And they described, the parents as being sort of anxious, nervous, and tense. And they did have the insight to point out that there's a chicken and egg thing, or the parents anxious, nervous, and tense because the baby has colic, or is it the colic because the parents have those symptomatologies. So again, it wasn't clear which came first. Was it the parents being overly uptight, or is the child causing the parents to be uptight and anxious about the baby's response to existence? So that was their literature review they did up to that point in time to look at it. And they also looked at 68 babies in the mother's baby unit at Yale at the time. This picture is actually a contemporary picture of the Yale University in the mid-50s in the mother-baby ward at the time. So that's kind of what it looked like back then. And the thing they found out and looked at these 68 infants was the time of onset of symptoms. And when you ask parents when colic usually comes on, a lot of times they can say they can set their clock by when the baby's going to start crying. And that's what's so frustrating about it. And it's usually the evening time for some reason. It's a little bit in the morning time when everyone's getting up and going, but predominantly it's in the evening time when the babies will have these problems. And like I said, like clockwork, they'd start having these issues. So, that's very characteristic of colic when you go forward. So if you're taking the history of families and you suspect that, that's sort of a characteristic of it, that is kind of the evening time that they have the issue to come up. And they looked at 29 of the babies to see when the colic actually started. Like I said, as you can see, it usually starts between 1 and 2 weeks of age. Occasionally it was right at a newborn, and sometimes it was delayed about 3 weeks of age. And typically resolved by about a couple months of age. Like I said, typically they say it would last 3 to 6 months and kind of resolves at that point in time. As you can see in these kids, it did kind of do that. A couple of kids ran out a little bit longer, the 6 months, but usually by about 3 months, the symptoms were resolved. So like I said, that's kind of the classic symptoms where you'll see in these kids that it's an evening time issue, starts about 2 weeks of age and resolves by about 3 months of age. Well, I used to tell parents who comes on 2 weeks and, like I said, resolved by 3 months in general. And in this, article 2, this 1954 article, he had a case report about, one baby in particular that was real problematic for the staff. And they said, one baby was particularly fussy, and again, the staff and the nurses were all very used to fussy babies, so they kind of did their best to try and help calm the baby down. And they said they tried the usual thing, the ritual that was described in the Babylonian tablet back in the 6th century BCE. And they tried, feeding, walking, holding, that sort of thing. And they got so frustrated that they contacted the attending in the nursery at the time. And the doctor ordered 1 cc of spiritus fermentate and 30 cc is 5% glucose, and as treatment for it. So I looked up to see what spiritus fermente was. It's actually whiskey. So at the time you give them a shot of whiskey, and so they gave it to the baby. The baby did a little bit better, so of course they gave him another dose. And after 2 doses of shots of whiskey, he stopped crying, went to sleep, and slept for 3.5 hours. So, if you get them drunk enough, they do fall asleep, but we kind of discourage that nowadays. But I thought it was interesting that was something they could order at the time. I'm not sure that Epic lets us order whiskey on the panel anymore. At the time, they just kind of summarized the things that were available in 1954. And again, the idea is sort of motion helps out some, because the thought is that either soothe the baby or distract the baby from whatever stimulation was causing them to be so distressed. Again, drugs, alcohol, phenobarbital, and histamines were ones that were used at the time. Change in diet, which is still kind of recommended today to some extent for both the mom and the baby to help them out. Oral gratification, because as we all know, babies like to suck, just calm themselves down. So thought if you gave some sort of oral gratification, pacifier water, that may help soothe them. Because when babies have colic, they'll draw their legs up and you think it's something related to the gut. So put some pressure, some warmth on the abdomen. We thought it may be helpful. And monotonous noise or music, sort of background noise, the whole white noise thing. I actually had a mom last week that I saw for a 2-month checkup, and baby had been diagnosed, the previous month with colic. And so because I knew I was giving this talk, I said, so what do you do to try and help them out? And she has the baby listen to music, it helps out some. Because it's Rocky Mountain, they like country music, so that was what she puts on in the background to help the baby out. So whether it helps the baby or the parent, it's hard to say, because obviously if you're listening to something that you enjoy, will calm yourself down. So hopefully it doesn't upset you as much the baby has the crying episodes. So 70 years later, like I said, when I got interested in this topic, because 35 years ago when I started my training, these were the things that were out there, so well, surely there's been some advancement in the last 35 years and 70 years since the article came out by Dr. Wessel. And unfortunately, the pathophysiology is certainly not understood. You wish they had something you could pin your hat on or hang your hat on to do it, but it's really not understood what to do. So the medications that, again, have been used over the years, obviously, opium, alcohol, and phenobarbital are not approved anymore. Gas drops, simethicone, that's sort of very commonly used. A lot of times we'll say, sure, try, gas drops, because it's a very benign substance, but it's not really been shown to be very effective in the kids. And some of these other ones, these anticholinergic agents and muscarinic antagonists, they work, but they have significant side effects. And in fact, the somatropium bromide has never been approved here in the US or Canada because of the problem associated with it. So they work, but it's kind of like giving opiates that doesn't really not good to give to the kids. So in the review of the literature, currently, like I said, complementary and alternative medicine, there was a big review that came out in 2022 that looked at 5 studies involving over 400 kids to try and see is there some of the treatments that may help out some. And they concluded that, osteopathic or chiropractic treatments, fail to reduce anything for the kids. Along the same line, too, the complementary thing, a lot of times parents will say they give their kids gripe water. And that's where it falls in the same category, too. And again, the studies haven't really showed it does anything of that. Part of the problem with gripe water is a very generic group of things. Historically, it always contained alcohol. And that's why it probably helped out some historically, because, again, the same thing, give them a shot of whiskey. They got to help calm them down. But like I said, with the gripe water now, it doesn't have alcohol in it. And it has all these different herbs, that, so there's really nothing that shows that that's really helpful. It doesn't seem to be harmful for the kids. But like I said, if it gives the parents some relief and give it to them, like the simethicone drops, it's reasonable to try as long as it's not anything that's going to hurt the child. But the complementary things, alternate medicines, really doesn't seem to be a much benefit to the kids at the time. And the big question too is the intestinal microbacteria, because that's big thing. The gut-brain relationship and all that is another big issue. And the thought is that the initial inoculum that the kids get when they're born, either through passage to the birth canal or breastfeeding or skin contact, they can pick up bacteria from the mom or from the environment. And that's sort of because when the kids are born, they don't have much bacteria in there. It kind of sets the standard for what their gut's going to do. In 2020, a Finnish study showed that newborns without colic didn't have lower abundance of the lactobacillus in the first stool. The first one they passed, they kind of cultured them all out, see what was in there. And kids who later developed colic seem to have less lactobacillus in the gut or in the intestine on the first pass. So the question is, does adding lactobacillus help out? Because if colicky babies tend to have less lactobacillus, is that beneficial or not? So there have been some studies over the years that looked at it, and one strain in particular, this Lactobacillus reuteri, seemed to look somewhat promising. And in 2021, an article looked at 15 randomized controlled strials, and they said that in breastfed babies, there's about a 50% reduction in the crying time of babies who are given probiotics. But in formula-fed babies, didn't really seem to have much difference, so they said more study was necessary. At the time this article came out and these trials were done, to nowadays a lot of the formulas are fortified with probiotics. This was before the probiotics were available in the formula. So like I said, that's one problem, is that formulas are not standardized as far as what's added to them. So that may be why they didn't have the results of or positive results for the formula-fed children as opposed to the breastfed ones. So it did seem to help some breastfed babies with their colicky symptoms. And could lactose be a factor? As you all know, humans are the only mammals who actually continue to consume milk post-weaning. And as an important part of being able to do that is that a lot of us produce something called lactase, which is the enzyme that breaks down lactose. And if you don't have that, then when the lactose hits the gut, the bacteria break it down, and that causes a lot of symptoms with gas and bloating and discomfort. And a lot of certain populations lose the ability to produce lactase as they get older. So some have lactose intolerance. That's kind of an issue. So the NN study came out 2 years ago, looked at 162 babies, and again they used the Rome 4 criteria to decide who had colic and who didn't have colic. And they gave lactase, the enzyme supplement, to breastfed and formula-fed babies. They gave it 4 times a day for 4 weeks. At the end of the study, it wasn't that statistically significant, but it did seem to see the babies had fewer symptoms, and the parents were happier. So whether there's a relative lactose issue or not, it's still not clear. It wasn't one of these things that was real clear cut, but it did seem to have some benefit potentially. And it didn't seem to make a difference between whether they're breastfed or bottle fed. And this is kind of more controversial nowadays, the nutrition modification, because we all know when we tell parents to use formulas, all the formulas out there, there's so many different varieties. And there's ones that are, the hydrolysate formulas, where basically the protein molecules are kind of broken down. And so that's a common thing that we suggest to people. And on the cans, a lot of people say, well, it may help with colicky symptoms in children. But people looked at it over the years, and in 2020, the British Medical Journal came out, and they're the ones that typically review all these different articles and come up with statements of their recommendations at the time. And at the time they came out with this, 4 years ago, they said that the evidence was really sort of lacking, and they were afraid there was a lot of bias in a lot of these studies, which if you've ever done a study, it's really hard not to have some bias to one way or the other. And they were afraid that a lot of the studies were done that showed efficacy, had significant risk of bias, they said. So the time they made the statement that they cannot recommend hydrolyzed protein formulas for treatment of infantile colic, which is still kind of controversial because formula reps swear by it, and several GI doctors I've talked to swear by it. There's a lot of anecdotal reports of it, but the literature's still iffy as far as whether that's really beneficial to it. And this ties in again to the original theory, 1901, about allergies and whether that plays a role or not. So like I said, I don't think there's any harm in suggesting that for families, some of the hydrolyzed formulas, but the study's really not back there to sort of prove that's beneficial at this point in time. And as far as this article, this Turkish study came out last year, it was kind of hard to wade through, but their one was a biorhythm disorder. What they looked at to see if colic, migraines, and biorhythm, so they looked at urine, serotonin, cortisol, and this mRNA, this H3F3B mRNA. And they said that the production of that, or the expression of that gene seems to act as a central clock, what they call it before, for a baby, as far as how you function throughout the day. And they found that babies who had developed colic tend to have more problems with defecation. Again, they're more sensitive to light and sound, back to the idea of the hypertonic child. And migraine frequency in mothers with colic. And they found that the sleep disruption was more common for the kids to have a sleep disruption than a control group. And because of that, they were thinking there was some connection between the biorhythm of the children who had colic versus those that didn't have colic. And they sort of used that as their explanation for why all these GI treatments that have been recommended over the decades weren't a clear answer to the problem, because they said it may not be just directly related to the GI tract. There may be other things going on with the kids, biorhythm that they had. So they kind of put that out there as a possible cause for the disorder. In addition to the,
Sorry, it might be minutia. I just had a question about that study. Were they being breastfed or were they being formula fed? I don't know if it really matters.
They didn't really differentiate that in the study, so it wasn't clear that they did that. I think they looked at about 160 kids or so like that.
Thank you.
In addition to being, just what the cause is, what does colic mean for babies going forward? Over the years, I've always told parents that if you have a baby who's kind of calm, they typically tend to children who are calm, and babies kind of just sort of high maintenance, kind of stay that way without any real evidence. Just my observation the last several decades. And the big study came out last year. It was published in one of the pediatric magazines a couple months ago. And Netherlands actually looked at 4,700 babies, that followed from birth up to 14 years of age, and to see what happens with these kids. At the time, they sort of divided them up into, they established sort of excessive crying and colicky symptoms by 3 months of age. But they studied all these kids going forward. And the kids who had symptoms of colic when they were little, when they're 10 years old, they did MRI studies, look at the amygdala volume. And amygdala is kind of the control center for emotions and things like that. And they found that these kids, who had colicky symptoms tend to have relatively smaller amygdala than control kids who didn't have evidence of colic. And they also looked at these kids, 5 different intervals throughout their lifetime, up from 1.5 years to 14 years of age, to see how well they were at, internalizing and externalizing behavior and emotion, and just how well they handle things like that. And they found these kids up until at least 14 years of age, ones that colics didn't have higher levels of emotional behavior problems in childhood. So it sort of tends to make you think that colic is not just a self-limited issue that when they're 6 months of age it's over and done with. These kids, for whatever reason, have a higher predisposition to having emotional behavior problems as they get older too. It didn't say it couldn't project forward past 14 years of age. That's all I studied too. But it was interesting that they were able to study this many kids and this sort of thing and do all these studies, because here in the U.S. it'd be hard to get funding for something like that. But that sort of makes you think that kids with colic may have more behavioral issues going forward. It makes you wonder if it's really just the gut or not. The other thing too, there's been several studies that have correlated to migraines in kids with colic. And it's been well known for a while that if moms have migraines, they have about 2.5 times more risk of having babies with colic. And another study that came out that studies kids for 18 years to see once they're colic, if they develop migraines or not. And they had about 2.7-fold increased risk of developing migraines without aura, kind of the classic migraines, by age 18. And so it's not clear, is colic a form of migraines in kids or more just a marker for genetics for migraines? Because we know, migraines do run in families, so there is certainly a genetic predisposition to develop migraines. So whether that plays a role in colic symptom or not, it's hard to say, because the kids obviously can't say they have a headache or something like that. But certainly, like I said, there is a connection there between migraines and the moms and the children that develop colic. And again, get back to this slide again too. So if you have patients that come into your clinic We all see babies all the time, and the parents say they're very fussy. You always ask about the timing because it is kind of this classic timing where it's an evening time, and that makes you think that colic may certainly be one of the symptoms or one of the reasons for it, even though we don't have a good handle on what colic is at this point in time. And so, like I said, in addition to the, the 1954 recommendations, so again, 70 years hence, so here in 2024, what are the recommendations for kids with colic? And the first step, of course, is to rule out some other issues as far as why they're acting like this. You just want to, say, oh, they have colic and they'll get better eventually. So you want to make sure it's not something you're missing. And that's why it's always important, particularly when they present 2-3 weeks of age with these symptoms, make sure it's not some underlying issue. So always check, the state screen, make sure there's not a metabolic issue that's coming up or something else that's causing problems for the kids. Make sure they're getting adequate nutrition because, when times are hard, you can breastfeed babies, the parents start diluting down the formula to make it last longer, and so they may not be getting adequate nutrition and make sure they're gaining weight properly and everything, developmentally they're doing what they're supposed to do. So that's the first thing to do always, to make sure that there's not some other reason, because colic is kind of a by exclusion kind of diagnosis. The key is parental support. So like I said, it's the highest risk factor for shaken baby syndrome in kids. And so you have to make sure you support the parent. You may not be able to do much for the child, but you have to be there for the parent and help them through it. And like this one that I saw last week, who they had colic and he played country music for, he was asking, are there people who can help support you? And she said, yes, her husband's there, he's helpful. Some of her parents are there in the area. So it's important to be able to walk away from it because, like I said, you have to deal with this child every night for week after week after week. There's a limit to what people can take. So it's important to be able to pass that responsibility off to others and give yourself a little break. So parental support is key. And again, over the years, there's so many myths about colic as far as what you do for it. Like I said, the idea of gripe water and do all kinds of things, and grandparents are great sources of both helpful information and unhelpful information. Not to pick on grandparents, but you make sure that the myths they bring, parent or the families bring up, to explore those a little bit and say why they're not really validated. And again, back to not speaking about chiropractors, but the CAM study showed the chiropractors, because I'll have patients which again, I can't imagine doing manipulation on little babies, but yet it happens. And like I said, someone taking the chiropractor trying to get them to help out. And as a pediatrician, it's not something we can recommend. And explain there's some limitation to the interventions. Like I said, the idea that probiotics may be helpful, they give you're breastfed, whether lactate's help or not, it may be. Those things are pretty benign treatments as far as interventions. So those things you can try doing, but it's not going to be this magic solution. You give this medicine and then everything's fine, but it may have some benefit for the children. And again, offer sort of strategies as far as feeding and settling, sleeping. Again, try to have someone be able to step in and help you out so it's not just the mom who's responsible for everything going on with the baby. And to try to reduce external stimuli, because again, back to the theory of the hypertonic child, some of these kids seem to be very sensitive to external stimuli. So you'll make sure that everything's kind of calm and semi-darkened, so you don't have a lot of external stimulation. And that's one theory that I've often had. Why it's at the end of the day is that because when the child before they're born, they're in a dark, even though it's a noisy environment in utero, and they come out in the light and the noise and the brightness. I think part of it is overstimulation. At the end of the day, it's like, yes, we've had stressful days, want to go home and scream. So the kids, that's literally what they do at the end of the day. So that could be why they're doing that. So questions for the audience. So dysfunction, which organ system has been proposed to be responsible for colic symptoms? A, respiratory, B, cardiac, C, central nervous system, D, renal, and E, integumentary. So who thinks A, respiratory? Who thinks B, cardiac? Who thinks C, central nervous system? Most people. D, renal. There is some called renal colic. This is different. And E, integumentary. And the answer is central nervous system. Good job. And so you're working in the clinic. You have parents with a 6-week-old breastfed baby. Reports she has cried 2 to 3 hours every day for a week. Her physical exam is normal. The following, the best initial management for this patient is A, administration of a gastroesophageal reflux agent. B, administration of a sedating agent, C, administration of antispasmodic agent, D, switching from breast milk to a hydroxylate formula, or E, reassurance to the parents that crying is normal. Who thinks E, the administration of a GE reflex agent? Who thinks administration of a sedating agent may be helpful for the parents, but not to the child? C, administration of antispasmodic agent. D, switching from breast milk to a formula, or E, reassurance to the parents that crying is normal. And E's again, parental support is the key for all this sort of thing. And while, colic is normal for, 10, 20, 30% of the population at some point in time, crying is the baby's way of expressing things. So it's normal for this child to cry. So you don't feel like you have to throw in some, therapeutic intervention right at that point in time. Like this is the best initial management of the kids. The points to ponder, Janet Suin's a pediatrician up at Hopkins, and this is, her statement is true for all things pediatric, not just for colicky babies. We're providing an attentive ear, empathy, and encouragement to parents to garner support, and rest of it may be our most important interventions. So again, that's true definitely for colicky kids, but definitely for parents in general, because that's, as pediatricians, that's what we know we do. We support the parents and be an ear for them to express their concerns and be empathetic towards them sort of thing. Because like I said, babies are all different and you have to be there to help them out. And if everything works well, so hope is that you have a nice quiet baby. That's the goal we all have. Thanks. Questions?
What is the thought now about swaddling? I know they've moved away from swaddling for sleep, but they said swaddling for comfort and colic. What's the actual?
I haven't seen any studies on that, but certainly, our experience is that, babies, because, I still think because when they're in utero, they're very compressed, and there's that freedom of movement when they're out and about, and that's when you get the more reflex and the startles that they have, and that sets them off. So I think if they are swallowed up, it makes them feel more secure. So, again, anecdotally, I think it helps out. I didn't see any studies about swallowing for calming, but it certainly does seem to help out from that standpoint. Otherwise, I know when you examine the babies, you undress them, they kind of startle themselves and start screaming even though you haven't touched them yet. Yeah.
When you were researching, did you see any twin studies where one twin was taken away from the other, or they were separated from adoption or something, just to see anything?
Yeah, I really didn't see that, no. That'd be a good thing to do. And you have to have a whole bunch of twins to do it.
I know.
But no, I didn't see that particular, someone looked at that.
And then another comment was, when I was young, earlier in my training, there was a guy named, I'm sure you can remember, T. Barry Brazelton, and he used to talk about states that people would go, that a baby would go into a neurological state or something, so it's not necessarily GI tract, and recommended kind of like the Babylonian thing you were talking about, just, hey, is the baby wet? Is the baby fed? Is the baby sleepy? Is the baby need some movement? Does the baby need a quiet room? And just kind of have a series of steps to go through every time that they start to have issues.
Yeah.
Sounds like we're about the same place that we were back in the 70s.
Yeah, and that's why I still recommend parents, is, they're crying, you make sure there's not some physical discomfort or something that's bothering them otherwise. So like I said, the Babylonian ritual that you go through to try and find out what's going on, because that's the only baby's way of letting you know that something's not quite right. So you want to make sure there's not something else going on that's responsible for it. So yeah, you're exactly right. So I think Terry was on to something back in the day. Dr. Kraft, you have a question?
Yeah, I just a comment. One analogy I use with parents is that, they wonder why their baby's so fussy. And I said, well, before they're born, they're like little spacemen. They're in a dark environment, it's quiet, they're weightless, and then all of a sudden they're out in the world and there's light and sound and temperature changes. And I mean, it's no wonder they're a little spastic when they first come out, because the environment has changed so much. And another a question I used to get asked a lot was, can I hold my baby too much? And I thought about that for a number of years, and you know, supposed to put them down and let them get used to quieting. And I thought to myself, well, what were people doing before we had heat and like we're living in houses and, babies, I think biologically are kind of wired to be held a lot. And I really believe that's true. And I think some are probably wired to be held all the time. So I don't think it's necessarily wrong to discourage parents from holding their infant a lot, because I think that's how they were provided safety and warmth before we really became civilized.
Right, and like you pointed out, we view it from our perspective now, but obviously humans have evolved over a long period of time before we had the luxury of, beds and heat and that sort of thing. So that's why so many of the cultures would have ways of carrying the babies with them at all times, because that is true. I always say, they were held for 9 months, so, they're used to being held in the environment and carrying them. And, not to pick up crap, but earlier when I was talking about this subject, he mentioned he was about possible connection between colic and IBS in older kids. So I know you didn't ask questions, but I was going to throw it out there. And there actually was a Korean study that came out 2022 that looked at a couple thousand kids with colic, and this was one a code research. Basically looked at the codes that for colic when they were little and transferred forward. There were kids who were diagnosed or had codes for IBS or some symptoms related to that after age 4 years of age. See if there's some correlation between the two. And there was about a 10% increase in kids with colic developing IBS symptoms versus the controls. So there did seem to be something related there with it. Like I said, it wasn't really black and white, but sort of tendency towards it. So which argues for some sort of gut thing, but none of these things would point out that yes, this is clearly the organ system at fault, and this is what's going on, because there's so many other variables involved. So it is hard to say exactly what the cause is for.
Are there any studies was somebody else asking a question?
I know we talk about the increased risk for shaken baby syndrome in these children, but did you see anything about like an increased risk for unsafe sleep practices in infants with colic?
Yeah, I didn't see studies address that. That is sort of an issue because, like I said, with the idea of holding the visa.
I mean, I just know from my personal experience, I have 2 with colic, one worse than the other, but definitely sometimes when you finally get them quiet, you don't want to put them down and start the cycle over again. And so you end up just holding them and maybe falling asleep in a chair with them. And it's not ideal, but it's something to explore with parents who may be going through that, and what are they doing with their sleep practices too.
Yeah, that's a good point. Like I said, that is exactly what you expect parents to do. Having done that, you don't want to jinx them by doing anything, by moving them or making noise or anything. Otherwise, they'll start all over again, and you try and avoid that. So you're exactly right. And that's the age where they're at risk for having the unsafe sleep practices, because it's easy for the parents to do that, to calm themselves down, and things can happen because of that, obviously.
The gripe water, which is used in a lot of different cultures, besides the alcohol, which probably was the active ingredient, it has a lot of ginger and fennel and chamomile. Are there any studies that look at those things separate and apart from the alcohol?
I didn't really see that. Like I said, I'm sure there's probably some literature out there, but I didn't really see that. I think because, like I said, there's so many variations on what's in gripe water as far as the components, and as you know, we get into herbs and that sort of thing as far as how much whatever active ingredients in there, as far as what it is. So it'd be hard to, being a scientist, it'd be hard to control how much you do unless you had some sort of artificially made some gripe water and put things in there. But yeah, like I said, it's in a lot of cultures throughout the world that's common to give to kids. Like I said, I think that was the alcohol that was most effective historically, but nowadays, what is the oral gratification because you're giving something, sometimes there's a little bit of sugar in it, so it's sweet. It's kind of like when you give them the sugar pacifiers in the nursery if you're doing procedures or something like that, where that's helping them out somewhat too. Like I said, there's a lot of factors could be playing a role, but in and of itself, just giving that gripe water is not, again, a magic solution. But like I said, the concoctions nowadays are pretty safe, so there's no harm in trying it if families seem to think they get some relief with them.
I don't know if this is for all gripe waters, but I've looked at 2 of them in the past, and the carrier fluid is pickle juice now. So I don't know if that's standard, but I'm sure it's cheap, and so it's been one of the things I noticed.
I think there's some therapeutic value for some parents in them being able to do something.
Right.
And I think that's underestimated and appreciated by a lot of physicians. One of the partners at Postal, when I first went out there, he said, parents, they want to be able to do something for their child. He said, advice is great, and we need to provide it, but sometimes we need to give them something to do so they feel like that they're doing something to help their child. And that's where I think things like gripe water or, a little bit, I know we're not supposed to treat a lot of reflux, but it should, and you didn't mention reflux, which I thought was interesting, because I think, a lot of moms think that my baby's refluxing because, all her friends' babies had reflux, and we're kind of the same way. And, so I think sometimes just giving the parents something that's safe and benign to do, it may not help the baby, but it may help them.
Right, because what parents don't want to hear is like, you throw up your hand like,
Yeah.
nothing I can say you do, just how to deal with it. So you're right, have some sort of intervention, as long as it's benign treatment, maybe placebo, maybe just, parents have to doing something to help their child. You're exactly right. I didn't mention reflux because, again, the basic for colic was that you don't have some underlying condition. If you really have reflux, and that kicks it out of the strict Roman 4 criteria. Yeah.
Dr. Kreider had a question online. Is there any research on colic and eventual autism or sensory integration dysfunction?
I didn't see anyone really look at that, to be honest, Dr. Ryder. Like I said, there was the Dutch study that came out last year, looked at the 4,700 kids, that indicated some behavior problems, but they didn't really address whether they were developing increased risk of autism or not. So, but certainly, since autism is a sensory integration issue, it makes sense if the kids were the ones that had problems with that integration, that could be an issue, but I didn't see any study specifically looking at that.
On the other end of the extreme, what are some practices that parents do that's considered unsafe or we should ask about, and just to make sure they're not doing that?
Well, the idea of unsafe sleep things. I remember early in my practice, there were some of the folks that they would give the kids whiskey. They'd sort of get a little pacifier and dip it in some whiskey and give it to the kids, or give them a little shot of whiskey, and it calming them down. But I remember this one dad, I kept saying, you really can't do that. He said, well, my mom did to me, and I'm fine. And you try to explain, it wasn't really warranted calling CPS on it, but you tried to discourage them every time you saw them for it. But that's one thing that they did. And luckily, I haven't had any families that use opiates to help out some, even though historically that's the solution. But
Is Paragoric still available over the counter?
Pardon?
Is Paragoric still available over the
I
counter?
don't know. I remember we used to get that.
Which is an opiate that
Yeah.
you could buy
Tincture
over the
opiate.
counter.
It's
Tincture
not
opiate.
available
Not anymore.
in this country. Yeah,
Okay.
it probably
But-
is.
But that was a good remedy that they used to use as well.
Yeah.
I was reminiscent about that the other day, and how when we were young, gives all kind of things, but Paragoric, it tasted horrible. But he used to give to us, that's a somebody else, tincture of opium is what it was.
Yeah.
And here, kid, get a shot of this and go be quiet. But yeah, so it's not that long ago that all these things were still readily available.
Our youngest was terribly colicky, and the most effective management was I would take him to Kroger and put him in the grocery cart, and he would quiet down almost immediately as we started cruising the aisles.
And things that do in the past, not unsafe things, but I know, motion of cars, a lot of people would put it in the cars and drive around. There was a device that came out probably about 20 years ago that you put on the mattress. It would kind of shake the mattress a bit to kind of mimic the movement of the vehicle. And that was kind of popular for a little while because, the motion and all that seemed to help out some. I guess the background noise too, so.
Washing machine.
Yeah. You could, with the top of the washing machine, put it in the gentle cycle.
On top.
But they would also, this is, I think, all the, putting the babies to sleep in all the swings and stuff, which is not recommended. But that was a common thing.
I looked around, I was like, oh, it's just
To
us.
simulate that motion that might help.
Yeah, so parents use all kind of things, like I said, and it's hard to know what to do. A lot of times they won't admit to it when you ask them what to do for it. They go, oh, we don't do anything wrong. So yeah, there are some things that do try and, because you heard the example of that baby crying, if you had that hours every night, you'd try anything possible to try and get them to quiet down.
So this, I haven't heard of it working, but I was just curious if there was any literature on it. You guys are talking about opiates being effective. And the only thing that we really have approved from an FDA standpoint for pain prior to 6 months old is Tylenol. Was there any study about Tylenol being effective?
I really hadn't seen that because, like I said, because, it's not really approved for kids underage, because we're about, the suppression of fever and all that. But I really didn't see any studies like that. But you're right, you would think that if it is just a pain sensation, some sort of pain medicine may help out some. But I really didn't see any studies about that. I'm not sure if IRB's approval would be difficult to get some of that or not, to be honest. But yeah, it makes sense if it is a pain situation. That it can help. Thanks for your time.
Is there someone online who wants to talk?
I just wanted to say, Mark, it's Amy Kreider. Thanks for this great talk. And I guess I just, also as a mom who had an extremely colicky baby, this wasn't several hours, this was all day. A lot of our advice is very tone deaf to these parents. And so I would encourage everyone to show some sympathy for unsafe sleep practices and those other things, because this is how these parents are surviving and handling their child. It's not inconvenient. It is extremely depressing, and these parents feel judged by the medical system and by others because of what they're needing to do to survive. So thank you for this presentation.
Thank you, Amy. Appreciate it. Well, thank you again.
Thank you.